very, very thankful that we have a panel to help us to understand and to go through this reopening of the campus. Let me also give you some logistical notes about how we proceed. The GSA submitted a list of questions in advance for this meeting, and we have shared those questions with our panelists. So each panelist will give a brief presentation based on the questions that were submitted in advance. And after everybody, the panelists have spoken, we will open to Q&A. At the moment, all participants are muted. And if you would like to ask a question, please do raise your hand, use the hand feature, and then we will unmute you. Our staff will unmute you so that you can really ask your question. We have done all this Zoom by ourselves, so big shout out to the team, Barbara, Stephanie, to help us, and Jeff to help us here. But clearly we are not able to follow most likely all the questions in the chat. So if you really want to ask a question via chat anonymously, please do use the direct message function and do message to Stephanie Kasha, our assistant dean, who then will ask your questions. So again, it's really a privilege to be with you here today. This is a second forum. As you all know, there was already a forum in regard to teaching for faculty, and we have sent you this meeting. There was a recording as well as the FAQs prior to this meeting around. But we really know that some of you are still concerned, are scared, you haven't been on campus, and that is why we are here with you, that we have our specialist panel to answer your questions. Of course, some of the questions which you submitted, the GSA submitted, were about housing. We all know it's all on our mind. We all know it is the most important thing to keep everybody safe. But we also agreed with our GSA e-board to separate those questions, and I will have a meeting with the GSA e-board, especially about the housing, where we look at each case and how we can help. And please be assured that the university is doing everything it can to help with this housing crisis. For instance, we contracted with the Best Western hotel just for graduate students, and I'm really happy to say that there's still rooms available. So campus housing went through the list and to the waiting list, and then went out to social media. And I'm really happy to say that there's still housing available there. But we have many other initiatives going on, and I will be happy to report to our GSA board this week. We're also very happy to say that we have now a Slack support manager directly dedicated to our graduate students, and of course the emergency housing support. So in short, please let's focus here on teaching right now, but please be assured that housing and all the concerns you have are really top priority for us, and we will tackle it as good as we can. So without further ado, I would now like to get started, and if it's okay, I would like to start with JeanMarie Scott, the special advisor to the Vice Chancellor, because JeanMarie is going to give a brief overview of the campus planning process, which she was instrumental and crucial and central from the very beginning. JeanMarie.
Good afternoon, everyone. Sorry about that. Somehow I'm muted. But anyhow, JeanMarie Scott, I am currently working with Vice Chancellor Latham on all things related to COVID, and I've been engaged in the process since the very start of the pandemic. My previous role on the campus has been specifically risk and safety services, including emergency management. So in that role, I stepped into the space of helping the campus coordinate all aspects of our COVID response. And that has been going on now for over 18 months. We're going to specifically, I'll address a few of the questions that the GSA provided for today that are about fall planning. But I also want to say that for anyone who has questions beyond today's presentation, please don't hesitate to contact me at jmscott@ucsc.edu. I'm happy to give as much information as I can to help prepare all of you to feel confident and comfortable in terms of coming back onto the campus, working in your academic programs and research, and definitely will make myself available as we go through the next several weeks and months. The questions that came to me were really more about process and planning. So I want to address a few of them, but I'll also later on we'll have some time for additional questions. So the first question was, how did we structure the campus-wide planning process for responding to the pandemic and then leading and coordinating all the efforts that had to be put in place and unfold over the past 18 months. Under the direction of the Chancellor and EVC, there were two primary groups that were assigned to work on planning. And one was our academic programs planning, which included our research area, and that was led by Executive Vice Chancellor and Campus Provost Lori Klutzer. And that was everything that had to do with research programs and our academic curriculum and employment and so forth. And then the other arm, or the other group, was under Vice Chancellor Latham, which was the Operational Resilience Group. And our focus was on the operations of the campus, including our sites that were away from the main campus. So UCO Lick, Coastal Science Campus. Our planning involved every aspect of university operations. And then under each of these areas, there were a number of different work streams, work groups, task teams. And some of them were formally charged as we went through the process of leading through the past 18 months. Some of them emerged based on the topic du jour of what we had to figure out. And as we went through this period of time, the groups and those engaged in planning became quite large and quite extensive in terms of the pandemic touched every part of the university operations. So we really coordinated that across our work groups. The operational planning and the academic planning were then giving guidance and direction from a steering committee that included the Chancellor and Executive Vice Chancellor, and then also representatives from our Office of Research, including John McMillan here, our health services with Dr. Miller, and student affairs and student success, and a number of different other key leaders of the campus that contributed to the high level thinking, planning, and then ultimate decision making that had to go into getting us through the past several months and year, as well as getting us prepared for the fall, the upcoming fall. So that's a little bit about how we were structured. All of that information is available online at the Roadmap to Recovery. You can see the structure and the org charts for how the campus was structured to move through this. I do footnote that the structure is very similar to what we would use in an emergency management response or an incident response, but it was just bigger because it touched so many different areas of the campus that we had to build a bigger structure, a more nimble structure, and one that had a larger number of individuals working both on the academic planning, research planning, and then operational planning. The next question was about the figure of 68% of in-person instruction, and I'm going to defer that to Jody Green. She'll answer that a little bit later when she provides information on academic planning. And then how about the question that came up about how do we estimate infectious rates and factor that into our reopening plans? I want to footnote that since the start of the pandemic, we engaged very quickly and brought in some of our research faculty who provided expertise in terms of infectious spread and doing algorithms to project how the campus might both understand our infectious rates, as well as to mitigate and or project infections. And that was where we then evolved into our testing program. In addition to faculty from our own campus, we also had advisors from UCLA that were in the beginning of the pandemic, were on the forefront of doing scenario planning and projections. And we've used those faculty throughout the whole process, and they sit on a few of our different committees. If you have detailed questions, John can certainly answer questions later. But in conjunction with them, but then also in working with our CDC, the California Department of Public Health, our Santa Cruz County Public Health folks, we basically have been in an ongoing process of monitoring our data, and that data includes both our cases locally, cases statewide and nationally, our hospitalization rates, our fatality rates, as well as our ICU bed space availability. All of those were pieces of data that throughout this whole process we've been monitoring closely, and they inform our understanding of how we are doing as a campus and how our campus is doing in the context of our local community, the county. And then where at different points in time we might have to adjust our planning or make changes in terms of how we're operating the campus. So those numbers will continue to be watched as we go forward. And then the next question was about limitations on our current reopening plans and what risks have been taken into account. I think we're in a pretty good place in terms of confidence to move into the fall quarter and into the expanded opening. UC Santa Cruz has taken probably the most conservative approach throughout the pandemic in terms of how we've approached resumption of activities on campus, resumption of our housing on-campus housing, resumption of our in-person teaching. We've really taken a very conservative approach. We are in a county, the Santa Cruz County, we had to make some decisions that were more conservative because we don't have as much access to hospital beds and other things in the county as we would if we were over the hill over in the valley. But overall, with that conservative approach, we've married that with a layered approach to our COVID mitigations, including starting with the vaccine policy and really pushing to advance our outcomes in terms of getting our population vaccinated. Then our testing program has been one of the more robust testing programs in terms of throughout this whole process, but even going into the fall. Our testing cadence for those that are in the mandatory groups, and then also making testing available for anyone who wants testing ongoing. Our classroom activities are preparing our operations, including our student housing, dining, student activities and programs. All have been approached with a very strategic and clear definition in terms of how we're going to do this and what's allowable and not allowable under our current operational plan. So those are a few things I want to mention. The criteria for shutting down the campus was another question that came in, and what are the thresholds we're going to use, and do we defer to other authorities in terms of a decision to shut the campus down. The decision making authority, decision delegated authority sits with the chancellor of the university. This is not something that public health, the county public health would make a decision on. They might advise us. We'll also take advisory from Office of the President, and we certainly map to the guidelines and requirements of Cal OSHA and CDC and California Department of Public Health. But by and large, all of that information informs any decisions that would be made by the executive leadership up to the chancellor's position. But again, I mentioned it earlier, our decision making and our assessment will take into consideration an ongoing review of our case numbers, local hospitalizations, fatalities, regional ICU beds, our quarantine and isolation program, as well as other considerations. But basically, I'll also mention the campus leadership has a very well-defined scenario planning document or model that we're using for COVID. It's modeled after the UCLA program, and it has very specific metrics for which the leadership we're monitoring, and then if needed, we would make decisions about pivoting any of a number of programs, including housing, dining, classrooms, activities, and other things on the campus. And with that, then one of the other questions that came in was, what will the role of campus police be in enforcing COVID safety measures? And clearly the PD, that is not their role to be enforcing COVID safety guidelines. It's really our peers, each other, campus leaders, managers, supervisors, and so forth. I will footnote that the police will respond if something imminent unfolds as a part of a COVID response. So for example, if a fight emerges or there's some other reason that the police have to get called for an imminent issue, they'll respond, but it won't be just for COVID, enforcing COVID policies. And then lastly, the other question that came in from the GSA was about, what about perceived levels of responsibility for the campus for large gatherings that might unfold off campus and might present concerns or health concerns for our campus community. And this would be maybe a major event, maybe a concert or something downtown, or something where our students choose to go to and could be perceived as a concern for the public health. The campus will work with, and we always do, with our local leaders in the city of Santa Cruz as well as the county. And in this case, because of the pandemic, we work closely with the county public health. So we'll reach out, we'll work with them depending on the nature of what's going on, then we'll figure out what our strategies are for responding. But if it is off campus, typically our role is, the university's role is to work with our cohorts, our peers off campus, and then figure out what's the best strategy for responding. So Peter, those are a few things from the questions that came in from GSA. I'll go on hold now and let my peers address the other questions.
Yeah, thank you so much, JeanMarie, and also thanks again for our graduate students who submitting these excellent questions. So let's go to Stephen Loveridge and Lisa Visser from Environmental Health and Safety.
Sure, I'll go ahead and go first. Thank you. So hi, everyone. I'm Lisa Visser. I'm the Director of Environmental Health and Safety and Risk Services for the campus. And our role over the past 18 months has been implementing many of these COVID policies and procedures and measures that JeanMarie mentioned. Our units have been involved in really, everything from face coverings to air purifiers to kind of all the other things that we've been able to put out and distribute to our community. So two of the questions that came in advance really refer to distancing. So I wanted to start with these two. One was pertaining to shuttles and transportation, and the other one, classrooms. So one thing that JeanMarie kind of mentioned was we've had a really big shift in our campus approach to public health with the availability of the vaccine and also the vaccine policy from OP. So in the beginning, distancing was what we had to rely on to kind of keep people separated and make sure we were minimizing and mitigating potential spread of COVID on campus. Now that we have vaccination, what we are really depending on from a public health perspective is vaccination or compliance with the vaccine policy. So the vast majority of our campus community is vaccinated. Those who have an exception to vaccination are required to wear a face covering, as we all are right now, and also to be tested periodically for COVID. So they're engaged in a program, given the policy that went into effect on September 9th. So that's really important for us and for managing spread of COVID. And the other thing I mentioned is wearing face coverings. So all interior spaces, including shuttles, buses, any kind of public transport, we're required to wear a face covering while inside and in those vehicles. That's how we are controlling the situation versus the beginning when we didn't have that vaccine. We had actually the shuttles, like 3 riders at a time. We have a different situation now, and that's where we are at the moment. And as JeanMarie says, the campus is closely watching our COVID rates and cases. Everything is very low at the moment, but we will adapt our policies and our procedures if needed as things change. The other one was classrooms, and I wanted to talk about this a little bit too. Same philosophy, right? In the classroom, we're expecting full compliance with the vaccination policy for everyone in the classroom, instructors and students. Because of that, we're not depending on physical distancing to keep people separate. We're really depending on compliance with that policy. There was a reference, and I want to bring this up, there was a reference to the incident in Marin County that happened in May, and it was widely reported in the media. There was a teacher who actually was unvaccinated, not wearing a mask, reading to their students, and of the 24 students in the classroom, 12 ended up testing positive because they were also unvaccinated due to their age. So that was really widely reported. And I just want to again point out that the key difference between that situation and our situation, again, is vaccination. So that's really where, and wearing face coverings and making sure we have a face covering, a face mask, something that will work for those who are teaching, something that works for those who are in the classroom. We have a lot of different options to share with everybody. And that's really where our emphasis is. With that, there were two other questions on ventilation, and I'm going to pass those over to my colleague, Steve Loveridge.
Great. Thank you, Lisa. So the first question about ventilation was great that yes, it's kind of along with those multi-layered approach that Lisa was talking about, the vaccine, as well as face coverings, and ventilation is another one. So all of our buildings, I'm going to try to cover both these questions about the filtering as well as air purifiers. So on the filter aspect, our buildings have been upgraded to MERV 13 filters, which is great. So that is what's called out in the Cal OSHA standard and other recommendations. Kind of along with that is that we have also maximized the outside air that buildings are drawing in. So this is for buildings that have forced air ventilation. Some buildings don't have forced air, but those will have windows. So trying to figure out or assessing your space wherever you are working or teaching and which ventilation option is going to give you the best benefit there. So outside air being maximized to the extent that the system can actually do that, as well as having windows. But in spaces where you still have kind of our more dense environments, multi-occupant offices, we are also, we have air purifiers available. So specifically for teaching spaces, our office, along with other risk and safety services staff, went out and visited each and every instructional space. So there are about 300 of them, and provided both sanitizer, just manual bottles of sanitizer to make sure it's out there, face coverings, surgical masks, so that if somebody arrives and they don't have a face covering or it broke on the way to class, you can still, they can have one. And also looking to see whether an air purifier is going to be beneficial for that space. So that has already been done for instructional spaces. That finished actually last week, just in time. But we're also, departments and divisions are also, we're working with them to find other spaces on campus where air purifiers would provide some additional benefit. And those, I think, were the two kind of the ventilation. So we definitely are putting air purifiers where we can, where they make sense. And the buildings both have been upgraded to MERV 13 and had their outside air maximized, so we get as much fresh oxygen as possible.
Thanks again, Stephen and Lisa. Great. Let's move now to Dr. Elizabeth Miller, the Medical Director at the Cowell Student Health Center. Liz.
Hi, everybody. Good afternoon. Is it okay if I share my screen? Can you see it? Okay. So I'm just going to give you a few updates and try to answer the questions that were asked of me. First of all, this is the dashboard from the county, the Health Services Agency, HSA, which is also called County Health or the Health Department. And so this is the epidemic curve of COVID. And as you all know, we had our biggest spike in January, and then had a nice lull period where we thought things were going well. We had another spike then in August, and it's coming down in September. So hopefully we'll continue with this trend. And this is our dashboard. Now, this is just June through September. So you can find, I just Google UCSC COVID dashboard, and gives you a lot of information, but I narrowed it down to just the past 4 months. So in June, we had no cases of COVID. And, like I said, we thought we were doing really well. Then Delta hit, and we had about 16 cases in July and August. We saw a peak in cases. I think this is 34 cases. The gold, our students; blue, our employees. So we had our first positive employees tested through the MDL since I think early February. So that was discouraging. But the amazing thing is we have only had 2 cases in September. This was, I think this was September 10th when these cases were reported. So we have one employee and 1 student. I heard today that, again, the pooled samples were all negative. Now, there may be some samples that were not pooled that we sent from sick people. However, not having pooled samples is really good news. So move-in has been very successful. So I was asked about hospitalizations and just ICU availability. So I'm going to go back to this slide. So if you're on the county's dashboard, you can get a lot of information up here. You can click on hospitalizations, and if you do, you'll get some information about our county hospitalizations. The blue dots are actual cases. The darker blue is the projection, and then the lighter blue is also projection for worst case scenarios. I guess worst and best down at the bottom. But anyway, this is what we're seeing is we saw the rise in August and then coming down in September. And if you click this button here, again, I'm on the county. This is from the county COVID page. You can get some hospital data. So I know this is kind of a busy slide, but if you want to look up just to see how many ICU beds are available, how many people with COVID are in the ICU in the area, you can go on, you can click that button in the county data. It takes you to the state, the California Department of Public Health website, and they have a lot of great information. So up here, this is the current number of positive patients who are in the hospital, and that's 15. The current number of patients with COVID who are in the ICU is 1. And the current available ICU beds right now is 3. So, and it changes day to day, but I would say over the past month or two, to have 10 or 15 patients in the hospital with COVID is not unheard of. And the majority of these patients are not vaccinated. Okay, just another one from this is from the California Department of Public Health website that kind of gives us a broader view of our ICU bed capacity in the Bay Area. So currently, there 22% of the adult ICU beds are available. And this is pretty good. If it goes under 10%, then that triggers a more serious situation. Okay, and just kind of going over the cases. Like I said, we had 16 cases in July, 34 cases in August, and 2 cases in September so far. All of these have been, well, the ones who they were able to sequence are Delta. And what we're finding with the vaccinated, almost all of the cases have been in vaccinated people. So what we found is that the symptoms are the same, pretty much exactly the same that we saw before the vaccines. However, the duration of illness is shorter, maybe 4 to 5 days, and the symptom severity is much less than before. Most people are surprised when they get a positive. Most vaccinated people that we're experiencing now they're pretty surprised because their symptoms are so mild. We have had throughout this, we've had no students that we know of with severe illness or hospitalization. And then just to let you know where we think they're getting COVID-19, most of the cases have a history of being in a group indoors, such as a bar, music venue, party, or some other indoor event where people are not wearing masks, or some people are and some aren't. And there's some crowded situations. Okay, and I think you probably all know about our vaccine compliance. So if you look at all students, it's about 91%. All faculty and staff, it's about 91%. Of the on-campus students, though, it's excellent at 98.7%. So this is about 9,300 students who plan to live on campus. Our goal was 90% for the campus, so I think we're doing very well. There was a question about boosters. So right now, because the recommendation is that we only offer boosters to immunocompromised people and those who are 65 and older, we are not giving boosters to anyone else. And we're focusing on students. We are not currently immunizing any employees. Of course, student employees, we would be happy to immunize. And we have a fairly good stock of Moderna and J&J. We do not have Pfizer. We are, again, not able to offer any vaccines to employees at this time because we're really focusing on students and all the other tasks that go along with keeping the students and the campus safe, such as testing and contact tracing, and then managing our isolation and quarantine queues. However, if you feel that you should have a booster vaccine, you can contact if you have an outside physician, or you can also go to CVS or Walgreens. And apparently it's quite easy to schedule those appointments. And just keep in mind, I know there is a lot of conversation going, lots of different conversations about how protective the vaccines are and which one's better. The bottom line is that all 3 vaccines are still highly protective against severe illness and death. And again, like I said before, the patients who are winding up in the hospital with COVID are those who are unvaccinated. There was a question about CAPS mental health services and whether we would be able to increase our staffing. And we have pretty much tried to increase staffing in all of our areas. And so we are continuing to offer 24/7 crisis intervention. We have in-person counseling appointments. We also have telehealth appointments. Some people prefer the telehealth. The groups, they just came out with the group list today, and that will be on the CAPS website. Apparently there are a lot of groups. Some of them are walk-in groups and some of them are scheduled that you kind of commit to going for a certain amount of time. This year we're offering medication-assisted therapy for opiate abuse. And this is something new for us, and I'm really excited about that. There is a self-help program, therapy assisted online. It's called TAL. And the link is on the CAPS website. And this is for people who don't, they don't want a therapist or a counselor. They want to be able to do it on their own. So it's a really interesting website and an interesting program that I would recommend. We are increasing the number of case managers we have, and this is a little redundant, but our case managers have some groups, and they're just amazing at what they do, and how many services they help our students with. So we're trying to increase our number right there. We have some postings that are out right now. We have a behavioral health specialist at Student Health. This person can help those with chronic illnesses cope with their illness. We also have enhanced our transgender student support, and increased the type of services that we've offered for those who are interested in transitioning. And we updated our website, and I think it's really nice. You can take a look at that to see all the services that we do offer. We have streamlined our antidepressant, anti-anxiety medication refills. So those are the SSRI refills. And you can now get a telehealth appointment to get your refill if everything is going fine. So it saves people a lot of time, not having to schedule a live appointment and to, find parking and come here. CARE, our advocacy group, they have added a self-ordered test that you can order yourself if you suspect that you have had a drug-assisted assault or attempted assault. And of course, this is not for people who are interested in pressing charges or taking this to court. It's just for someone's personal information. But that will be a self-ordered test that you just go onto the Student Health website and order it, and then make an appointment, come in and get the sample done. Psychiatry is increasing the number of hours that they have in their ongoing medication management program. And we do have psychologists who are dedicated to grad students. I believe we have 2 full-time psychologists for that. And there was a question about what treatments do we offer for COVID-19. So I can't stress how important prevention is. And so vaccinations are, of course, the first line, and wearing a mask. Hydroxychloroquine, ivermectin, and the new one, which is betadine. These are not helpful, and they can certainly be harmful. So I don't recommend any of those. If you test positive for COVID-19 and you are a student, please contact Student Health Services and we'll help you. Employees should contact their personal physicians or providers. For treatments, we've had, let's see, 300 and something students that we followed very closely on who've been positive for COVID-19, and the majority of them have done really well with just over-the-counter medicines that you would take, for a cough and cold. I do find that some patients need albuterol inhalers, even people who do not have a history of asthma, and the albuterol inhalers have been extremely helpful for several, many people, I would say. So sometimes that's all you need, just maybe some, Dayquil and an albuterol inhaler. For people who are high risk, Dominican Hospital offers a monoclonal antibody infusion. And this is Regeneron. That's what they've been using for a while. It is effective against the Delta variant, and that's why they have chosen Regeneron. And it's given in the emergency room as an IV infusion, and then the patient is sent home. So it's not overnight. It's just as long as it takes to get the infusion in. And the goal is to get it into someone as soon as they have a positive test, if they are eligible for it. And eligible people are those who are immunocompromised, those who are 65 and older, those who are obese with a body mass index over 30, people with diabetes, cardiovascular disease that includes hypertension, and chronic lung diseases, which includes moderate to severe asthma. And so if we do screen our positive patients for these conditions. There are a few others that we screen for also. And if they meet the criteria, then we do send them to Dominican Hospital for the infusion. Okay, and this is just a picture of the badges, just so everyone knows it's either cleared or not cleared. Green is cleared, yellow is overdue, which means you're overdue for testing or for your symptom survey. And then red is either not cleared, in quarantine, or isolation. And employees should have, if any, a blue badge because this is only for students, it's not for employees. Okay, and then just a reminder about face coverings that you want to make sure your face covering fits properly, as Lisa has always said. So make sure that what you wear follows the CDC mask recommendations and that it's well fitted, especially around the nose and chin. Okay, I think that's it. Thank you for having me. It was a pleasure.
Oh, thank you so much, Liz. And I think for all of us here, this was really extremely helpful. And a reminder to everybody, we will share this presentation. And also, as you see in the upper left, we are recording this session so that you can watch that again. Thank you very much, Liz, indeed. Next, we have Jody Green, the Associate Vice Provost for Teaching and Learning and Founding Director of CITLA. Jody.
Hi, folks. So I noticed that we are way over where we said we would be with relation to opening up for questions. So hopefully someone can devise another way for you to offer your questions. I'm going to try to go really fast because all but one of the questions that I was asked are already easily available on campus websites. And then we have Danny, and then hopefully we can have some time for your questions. So the first question I got kicked over from JeanMarie is who came up with the 68%? Very interesting story. The number was 85%. That was what we were asked to do by President Drake. Our campus decided differently from other campuses to kind of let people go down to 75. What ultimately came forward was 68. So it's actually a story about our having been given a lot more lenience than other campuses have been given. Some of you may have seen the paper a few days ago with a letter from a parent who has twins starting at Berkeley and Santa Cruz, noting that one twin had fully in person and the other had none. So the pressures that are on us to return to in-person instruction are considerable, but the campus has made absolutely every effort to keep those numbers, within a reasonable range. Second question that I got is a question about non-compliant students with masking. We have created sample language that you can use. It's easily available on the Keep Teaching website. There's lots of suggestions there for the question, what did TAs do if students refuse to comply with COVID safety guidelines? You can ask them to leave, you can call conduct, or you can start with just asking them to put their mask on. One suggestion that we make is that you say something like, some folks in the room seem not to have their mask completely on. Instead of saying, little Bobby, you don't have your mask on, you may get better compliance by generalizing your request than by specifying a particular individual. And I see that there are also a lot of department managers and faculty members on here, so I know that you have also heard this already, so forgive the repetition. What should students do if instructors do not honor their safety concerns? I would say speak with the department manager about that. Speak with the department chair about that. So you could go from the grad advisor to the department chair. Are instructors being encouraged or facilitated to take their classes outdoors? Instructors are certainly allowed to take their classes outdoors, but there are some things that you would want to consider there. And again, I'm just quoting directly from our website, which goes through all this. Outdoor spaces may not be accessible to students with disabilities or existing medical conditions. So you would want to survey your class before taking it outside to ask students if they have any accessibility concerns. There won't be power outlets for laptops. Their weather may change without warning. Sprinklers may engage unexpectedly. Lecture capture and recording are not available, and natural hazards like ticks, poison oak, and turkeys may be present. The last question that I had was, will instructors be informed if they have unvaccinated students? The answer to that is no, they will not. That is privileged information related to the student's privacy. but they will know whether students are complying with the campus vaccination protocol. And again, you'll find that information on the Keep Teaching website in the FAQ that we've prepared for you. So if you have other questions related to instruction, chances are you'll find them there. And with that, I'll pass it on.
Thanks so much, Jody. And again, we of course can answer your questions also later. If there are any other questions which we haven't answered and new questions, and if you're running over time, do please send them to the graduate division and we will get back to you with answers. So now it's Grace McClintock, Assistant Vice Provost of Academic Personnel, and Danny Gray, the Director of Academic Employee Relations. Danny and Grace. You have to unmute yourself.
Hi.
Yes.
Hi, everybody. I will also be quick here. I am Danny Gray. I'm in the Academic Personnel Office, and I was asked to address just a few questions sort of related to employment of graduate students as graduate student employees. And one or a couple of the questions pertained to shifting a course from an in-person assigned course to a remote course. And I think the easiest way to address this is just to talk about the two paths that any instructor at UC Santa Cruz has available to them if they qualify in the way that I'm about to describe to request that an in-person, whether as a TA, a discussion section, or as a GSI, a lecture course, shifting that from in-person to remote. The first one is if an instructor or a TA has a disability, some medical condition that is documented by a healthcare provider that gives rise to advised or recommended restrictions that the instructor not teach in person for fall 2021. And if an instructor has such a concern, has such a medical condition, they are advised to reach out to me and our campus disability manager, Kelly Roberts, and we will walk you through that process. So that first one, if an instructor has their own disability where their healthcare provider is recommending that they not teach in person due to that disability. The second opportunity to move from in-person to remote pertains to if an instructor has a member of their immediate household who has a health condition where they are moderately or severely immunocompromised, such that under the current CDC guidelines, they would qualify for a booster shot. And if you are in that situation, there is a form to fill out. It's actually to be filled out by the instructor and also by the healthcare provider of the family member, the immediate household member. And then also we ask that the department chair send just a 2-line email that discusses whether or not the class or discussion section can reasonably be taught through a remote modality. And with those two pieces of information, we are able to process those quickly. So those are the two ways in which a course can move from in-person to online. I had another question about the compensation for TAs and GSIs as it relates to the possibility of multiple modalities. And I think what this is referring to is in some of the guidance, it's been noted that an instructor may have a student that is isolating or in quarantine, and the guidance says something like, if it is possible for that student who is isolating and can't come to class to sort of keep up with the class through a remote modality, then that's a good solution. So I think that's where this question comes from. The TAs and GSIs will not be compensated extra for managing remote modalities. I will say that teaching assistants, as part of their contract, their collective bargaining agreement, there's a format and parameters around workload. And so the guidance that has been sent out has advised instructors that are supervising TAs to be very mindful of those workload limitations as we go through this interesting quarter where there might be some opportunities for multiple modalities. So that can be a concern, but it is not contemplated that, except in perhaps very unusual circumstances that I frankly am not foreseeing, that there would be additional compensation for that. So with that, I'm going to stop, and I see that we have at least a few minutes left for questions.
Thank you very much, Danny and Grace. And please also let me say again, those questions were excellent, and they were actually not asked in the previous forum. So that's why I do believe it's important to listen to our panelists, even if we went a little bit longer than anticipated. Now, again, I say this will be shared, the list presentation as well as the recordings. All questions which we don't get to right now when we open the floor, please do send them to the grad div, and we will go through them and answer them one by one. So now, please do raise your hand, and then the staff member will unmute you if you have any other questions which were not addressed yet. And our panel is still here, so I will then ask the panelists to jump in. Again, if you please raise your digital hand at the bottom, then we unmute you. Any comments or questions in the chat, Jeff, Stephanie, or Barbara?
Hi, thank you for this. I'm wondering if you've thought about, and I'm sorry I missed the first 20 minutes or so, so I'm hoping this wasn't already answered, but hearing issues related to masks. I'm a TA and a student, and I'm hard of hearing, and I really I also live with immune compromised people and think that masks are really important indoors. I also have one of those masks with the plastic where you can see my lips move, which I think is really great for accessibility, but doesn't meet the guideline of having multiple layers of fabric. And I was thinking maybe something like microphones could be helpful for this. Have there been discussion of this?
Yeah, I can take that. So absolutely. We have many different kinds of microphones. You can read about them and about how to get them on the Keep Teaching website. In addition to the classrooms that are equipped with microphones, we also have ordered and begun to distribute basically personal speaker packs. So it looks like the kind of classroom mic that you would have with a battery pack, but in lieu of the battery pack is actually a speaker pack. Michael describes it as a Walkman, but I don't think he knows. Some people don't know what a Walkman is. So that's what we have, and we are not assigning these to the classrooms. We're assigning them to the individuals. So they have been distributed to the divisional IT computing folks. So you can contact your divisional IT, or you can contact your grad advisor and ask your grad advisor to contact the divisional IT folks if you don't know who they are. And if you're teaching in a college, then Jay Olson in ITS is arranging to have these made available to people teaching in the colleges. So we're very aware of the amplification. There is another thing that the EVC has made available, which is like your mask, but those masks fog up for a lot of people. And so there's a kind of drape with a clear face that can be used that are available. I don't know if they're here yet, Steve, but they're going to be available through environmental health and safety. And that's an alternative to a mask to be used by people who may be teaching students who are hard of hearing in their classes and need to lip read.
So how are we supposed to hear our students?
Got it. So there would be a couple of different possibilities for that. One would be to pass around the pocket speaker. Some of the classrooms maybe, and some of the divisions, and Michael Tassio may be able to address this, have got these things called OWL devices, and you might be able to request that. Michael, do you want to say what the OWL device is, or tell me that that's not the right solution?
If the students are in person, it's not the right solution. I think the best solution here is having something like a personal amplification device that's passed around the classroom. And Maya, you could also just write to me. I'll direct message you my email address, and I'll get you a personal amplification device.
All right, thank you.
And depending on what classroom you're teaching in, that might be one where actually a handheld mic would be the best solution, but we would have to make sure that the classroom was equipped, or that we got you into a classroom where a handheld mic would work. And for those who are wondering about the health and safety consequences of this, because droplets don't go through our masks, it's not a worry to have someone pass the mic to someone else. You're not going to catch COVID from speaking into the same mic.
Thank you very much, Maya. Another question? Okay, so if there are no other questions, please do let me thank especially our graduate students for submitting this excellent questions to all of us, and for our panelists to be here and helping us through this difficult time, and understanding our voice and giving us really this excellent information what we heard today. And please, this is not the end of it. We have an open communication line. You see all the panelists here. You have received the information. So it might be easier if you send it to the graduate division, and we then channel the questions back to the specialist. But please, you heard that, for instance, Michael said, Maya, just send him right away an email, because we want to make you feel comfortable when you go into class and being the excellent teachers you are. And we try everything at this university to help you to feel safe and to continue to be the best teachers ever. So thank you very much with that to all of you. And do please send us your questions if they were not yet answered, or if you came late and you're not sure whether the questions were answered and you didn't want to raise your hand here, please do send us your questions. And please stay safe and all the best. Thank you very much, everybody. Thank you.